The WHO Director General, Dr Tedros Ghebreyesus, has hailed the scientific community for its speedy response to COVID-19 pandemic, including the record-breaking development of vaccines. He was speaking to the media briefing the first day of his visit to South Africa in Cape Town. He met with the country's top medical scientists and senior government officials, including the President of South Africa, Cyril Ramaphosa, as well as his Health Minister, Dr Joe Phaahla. He says it's incredible that within a year after the WHO convened scientists from all over the world to tackle the COVID-19 pandemic, the first vaccines were developed and approved.
2 years ago, the world was still coming to grips with the spread of a new coronavirus. WHO did what only WHO can do. We convened hundreds of scientists from around the world to identify the most urgent priorities in research and development. Among them was the development of vaccines. Tomorrow marks the second anniversary of that first meeting convened by WHO. It's incredible to think that within a year of that meeting, the first vaccines were approved. And just 2 years later, more than 10 billion doses have been administered globally. The development and approval of not one, but several vaccines in record time is an extraordinary scientific triumph that sets a new standard. There can be no doubt that vaccines have saved countless lives, are helping to turn the tide on the pandemic. That's why we're meeting in person after a long jail, and are now giving many countries the confidence to relax restrictions. But as you know, this scientific triumph has been marred by vast inequities in access. More than half of the world's population is now fully vaccinated, and yet 84% of the population of Africa is yet to receive a single dose. Much of this inequity has been driven by the fact that globally vaccine production is concentrated in a few, mostly high-income countries. One of the most obvious lessons of the pandemic, therefore, is the urgent need to increase local production of vaccines, especially in low and middle-income countries. That's why, in April last year, WHO issued a call for expression of interests for establishing a technology transfer hub for mRNA vaccines.
All right, joining us to talk a little bit more about the significance of Dr Tedros Ghebreyesus' visit to South Africa and what his engagements today and tomorrow look like, particularly in Cape Town. We're joined by Dr Sibongiseni Dhlomo, who's the Deputy Minister of Health. They are co-hosting his visit along with the Department of Science. Dr. Dhlomo, very good evening to you, and thank you so much for speaking to us. Before we get into the actual diary, the whole importance of this visit is particularly aimed at Africa's self-sufficiency with regards to combating COVID-19. The issue of the milestones reached in the vaccine development was pointed out there at that press briefing by Dr. Ghebreyesus. In your meetings, what were some of the salient points that came out of it that you engaged him on?
Thank you very much, Tepiso, and thanks to your listeners and viewers. The marking point was, you would recall, when our president finished his chairpersonship of the AU, he then was asked by the AU to remain and champion the vaccine access for Africa, because as the WHO Director General is saying, it became a product that was available to the few and the rich, Now, this is the issue that he was here mainly to say. Firstly, he commends our country for having a champion like the president who is championing not just for South Africa, but for Africa. Secondly, there is a good infrastructure into the country and a lot of scientists, rich scientists who are able to actually take the call and a request from the WHO to establish vaccine manufacturing sites, doing research and doing clinical trials, so that the first will be Africa and maybe the rest is the world. So we are very clear that the work that is being done by our scientists, supported by our government, of course, under the stewardship of the Minister Nzimande, Minister Phahla, is geared to really make access to Africa, not just COVID-19 and any other future pandemics, including what we are still grappling with, vaccines against TB, malaria, and all research work that will actually lift us up as a continent. That was mainly through his desire to come and check the progress that we are making in this regard.
As you talk about progress, and I was going to ask you something else, but perhaps before we lose sight of this train of thought, the relationship between vaccine development with other diseases and viruses. You spoke about TB, malaria, but there's also HIV/AIDS, which has been brought to the fore, understanding how not only transmission, but how different people react to COVID-19 if they have some of these comorbidities. The President of South Africa is saying this is a great opportunity to show off our intellectual and technological capacity. What have our scientists found in light of this? Because this is part of the research that South Africa is doing to share with the world at large.
In fact, we went to another place called Afrifan before we went to see the president to actually have a visit and also just a meet and greet with the delegation before we then went to other various vaccination sites. And the issue was, we are here to firstly recognize President Ramaphosa that in your country there is rich history of scientists who are world-renowned. That is why, in fact, in the words of the WHO Director General, says we were surprised and, in fact, perturbed that when your innovation by your scientists, led by Professor Tulio, brought into the world, which is a rightful thing to report any new in your surveillance, in your screening, and you pick up, like we did through Professor Tulio, a new variant Omicron, reporting to WHO, that was not supposed to, because you are then hamstrung the scientists. We, because of that, got a backlash of a travel ban. And the WHO Director General himself today was saying that was so unscientific. It was not pushed by any desire to encourage our scientists. So firstly, it was coming to acknowledge that and to say, go on, scientists of South Africa, of Africa, we are giving you all the support necessary. We're delighted that there were other countries and ambassadors from Germany, Norway, Sweden, and France, who also are giving their own support in terms of the development of vaccines, so that in the near future, we should actually be saying we are not waiting for vaccines that are firstly going to be accessed by the rich and those who have got money. But look, at South Africa, we are sitting at 42% vaccinated, but there's no country in Africa that is close to 10%. As Dr. Tedros was saying, that there are still Africans who are waiting at least for just one dose in Africa. And that there are countries in the world that are vaccinated for almost 95%. It cannot be. This is actually in the words of the minister from Sweden, no one should be left behind. Health is a public good to be accessed by all citizens of the world. and hence their contribution, which we really welcome. We're very fascinated today by the recognition of the role that South Africa is playing in Africa, but by their continued support, by realizing how rich we are in terms of our scientists and the wealth and the political leadership that is provided by our president and ministers.
All right. Dr. Dhlomo, is there any new information from the scientists to share on COVID-19 in relation to other comorbidities? As I mentioned, the trio of TB, malaria and HIV/AIDS, but also part of the visit is for the WHO Director General to, survey the progress with regards to mRNA technology, vaccine technology transfer, the hubs that we have built here in South Africa, and also the ongoing vaccination that you've just mentioned. What can you share with us with regards to that?
No, so that was not part of the report that we probably got today.
Okay.
All that I can report for now is that this mRNA vaccine manufacturing and processing is up and running. There are certain, of course, expectations, and what they put together, they were, among other things, saying there's a continuous engagement with SAPRA in terms of actually being closer to them, indicating the trials as to, because this process will need a particular way of getting it to one animal sort of clinical trials. We move it up to a group of people. So it is at that level of being put together. And we did not touch that. I would not want to venture in terms of the contract, sort of if there are any interactions between, at this stage, the COVID-19 and the other disease patterns. Of course, safe to say that part of the research work that our scientists are doing is to look back into, yes, among other things, where are we? Can we be able to, among other things, manufacture a vaccine for HIV, for malaria and TB and all others, so that we could actually also make headways, because these remain real endemic diseases in Africa and in our country, South Africa.
As you mentioned, the presence of other ministers from other countries, including Germany, Belgium, are there talks on the sidelines, bilaterals that are occurring between South Africa and these countries on what aid we can get from them, particularly in terms of vaccine access, against the backdrop of the inequity which you've just highlighted, that for instance, in Africa, we're only beginning to talk about booster shots, whereas in other countries on the continent, people haven't even received their first dose. What room for cooperation is there, Dr. Dhlomo?
Ms. Mariema Kitty, the Minister of Development, Cooperation and Urban Policy in Belgium, was part of the delegation that was led by Dr. Tedros Ghebreyesus. She says, I am not a scientist. I'm also not a researcher. I'm just a politician from Belgium. I am here pushed by what I see, that I come from a country where all of us can vaccinate because we have resources. I am a health activist of saying we cannot have other people in the world not accessing vaccines and the rest of the health infrastructure. Therefore, there was a contribution. I would not be able to quantify what actually into this pool of programs that we have is been a contribution from Belgium, from France, and from Germany. But they are here not just on a moral contribution, but they've also been able to financially support the establishment of these vaccine, mRNA vaccine manufacturing sites and clinical trials and all that. So I won't be able to quantify their financial contribution to
But
this
here
matter.
is something you can speak about, Dr. Dhlomo, as a final question. Today is the International Day of Women and Girls in Science. I know you're a great believer in empowering this sector in the health sector. So the importance there of how do we get more women and young girls, make them feel welcome in the sector so that they can be the pioneers of vaccine development in future, so that they can create vaccines which are specific to South African context and environment in line of this inequity that we're talking about.
Or are you talking about how can we be able to improve the pool of women scientists?
Yes, women and girls. Today is International Day of Women and Girls in Science.
Yeah, maybe the first thing is to recognize that in our country and in the world, the people who really are in the majority are women. And number two, these are people in the world who are always having a health-seeking behavior as opposed to men. And really, I would always say this, and not necessarily to say, if you look after women and the young girls, the rest can follow, because that is the pool of people who actually can look after themselves. They look after children, and then some of them, a majority of them, look after their spouses, or sometimes spouses who are not able to look after them. So if you look after women and make sure, and if you then develop, because the country that is showing significant development is those countries that have shown a biasness towards developing women and women's struggles and women's health and put them as a priority. So if we do that, as we are actually doing it, because it's the slogan that nothing for us without us should be actually be championed by women also among to say, don't talk on our behalf when we are not there, when we are not making decisions about us. So that actually we might as well forget what are issues that are pertaining to our own country's development. It is a maximize the contribution that you can make to preserve and prolong the life of young girls and women.
Well, thank you so much for your time and sharing with us details of that visit by the WHO Director General's two-day visit to South Africa, Dr. Tedros Ghebreyesus, and on that International Day of Women and Girls in Science. The WHO Director General saying that he reinforces the WHO's commitment to full and equal participation of women and girls in health science. And he's saying there are quite a number of inspirational women that need to be acknowledged and thanked for their inspirational leadership in the sector, particularly in their COVID-19 response work.